Hi friends, I am Dr. Jayanti Kamath, IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center, Andheri, Mumbai. So today we will be talking about fibroids. Why are we talking about fibroids? Because they are the commonest tumors found in the reproductive age group. Many a times women go for a routine sonography and they discover that the sonography report has a fibroid in the uterus. So they get very panicky and alarmed. So there's nothing to panic. Fibroids are basically benign tumors. Now what I mean by benign is they are non-cancerous tumors, and the chances of a fibroid turning into a cancerous tumor is very, very rare. Fibroids are found in 40% of women in the reproductive age group. They say that for a small fibroid to reach the size of an orange, it takes about 3 years. Now the rate of growth of fibroids cannot be predicted. It varies from patient to patient, and sometimes in the same patient it varies. About 20% of women and in the age group of 20 years, fibroid is found, and it is also found in 40% of the women around the age of 40 years. Usually it is seen in nulliparous women or women who have not borne a child. It is also associated with certain conditions such as endometriosis, endometrial hyperplasia and endometrial carcinoma. Now a lot of women tell me, doctor, I do not have any symptoms, and how is it that a tumor has growing or has grown within me? Yes, it can happen. Fibroids may not have any symptoms. Now let us get to know what are the different types of fibroids. So depending on the location in the body or in the uterus, fibroids have been classified as the subserous fibroid. Now this is the uterus. Subserous fibroid is on the outer surface of the uterus. Then comes the interstitial fibroid. Interstitial fibroids are within the wall of the uterus, or the uterus consists of muscles. There are the muscles in the uterine wall. So this interstitial fibroid are within the uterine muscles. Then comes the submucous fibroid. Now we all know that a uterus is a hollow organ. There is a hollow inside where the pregnancy grows. So some fibroids are very close to that hollow, they are called as submucous fibroids. Then there is another variety called as cervical fibroid. Cervix is the mouth of the uterus. So these fibroids are lower down. Now what are the symptoms of fibroids? As I said earlier, fibroids may not have any symptoms. Then what are the common symptoms which are associated with fibroids, if at all? So there are symptoms which are related to menses, like dysmenorrhea. What do I mean by dysmenorrhea? It is pain during menses. A woman who never had pain throughout her life will suddenly experience painful menses, or she will experience heavy bleeding during periods, or if the fibroid is a polyp and it is hanging inside the uterine cavity or the cervix, it can lead to bleeding in between periods. Now there are certain symptoms, other symptoms like pressure symptoms. So we all know that the uterus is surrounded by organs on all sides. So in front of the uterus is the urinary bladder which stores urine. So when the fibroid grows, the size of the uterus increases, it causes pressure on the urinary bladder which is in front of it, and this can lead to incomplete evacuation of the bladder. The patient feels the fullness of the bladder. Patient feels that the bladder is filling up, but she cannot pass that much amount of urine, that is incomplete evacuation of urine. Second, she may have that fibroid may keep on irritating the bladder, so she may have to pass urine more frequently. So these are the pressure symptoms, and just at the side of the uterus there is a very heavy vascular network or blood vessels. So if the fibroid is encroaching on the blood vessels, it can also lead to varicose veins. Coming to cervical fibroid, as I said earlier, it can give rise to dysmenorrhea, it can give rise to bleeding during menses, and it can also give rise to bleeding in between menses. Then what about infertility? So every fibroid seen in an infertile patient need not be removed. So what are the effects of fibroids on pregnancy and conception? If the fibroid is submucous, it can interfere with the implantation or pregnancy, and if it is very small, it need not be removed. Then what are the effects of, and it can also cause abortion and premature labor or malposition of the baby. The baby does not have space, so it can give rise to abnormal positions during pregnancy. Then what are the effects of pregnancy on fibroids? As we all know, during pregnancy, the uterus keeps on increasing in size, and it gets more and more amount of blood supply. So this blood supply goes to the fibroids also. So fibroids usually grow during pregnancy. A slow growth, the slowing of growth can occur in fibroids at the time of menopause or during the perimenopausal age. But sometimes 10% of the fibroids grow even after menopause. Now, what is the treatment? Suppose the fibroids are small and they do not cause any symptoms, they do not cause infertility, do not cause any menstrual symptoms, pressure symptoms or infertility, you can just leave them alone unless the fibroid is very huge in size or it is growing rapidly, or as I told you about the subserous fibroid, if it is attached to the uterus by a stalk, then the fibroid can turn or twist on itself and give rise to severe pain. In such conditions, even if the fibroid does not produce any symptoms, we have to remove the fibroid. Now, how do we remove the fibroid? Now, there are various options: surgical option and medical option. So what are the surgical options? Surgical options is myomectomy. Myoma means fibroid. Myomectomy is we are removing only the fibroid. So this can be done both by the open method as well as by the laparoscopic method. No matter how big the fibroid is, we can remove it laparoscopically. Then there is a medical method. There are certain drugs which decrease the size of the fibroid for temporarily. So the doctor will decide what treatment you need. Then coming to removal of the uterus, which is hysterectomy. So hysterectomy is always done in older patients who have completed their family, who are over 40 years of age, who have had previous surgeries for fibroid. So in such patients, we remove the uterus and it is called as hysterectomy. Now this hysterectomy again can be done by the open method as well as the laparoscopic method. If you have any doubts about fibroids, please contact me on librate.com. Thank you.